50 years ago, the Surgeon General warned us about the use of tobacco, a half a century ago. And today, as a result of the passage of this bill and the President's signature in the next few days, whenever that occurs, for the first time, the Food and Drug Administration will be able to regulate tobacco products. They can regulate almost everything else we ingest or consume, including that which our pets consume and use. And yet tobacco has been excluded.
It's been outrageous that these companies have been allowed to add any substance, including known toxins and carcinogens, to their products without informing the consumers. They've added ammonia to cigarettes. They claim it improves, quote unquote, tobacco satisfaction. In truth, it's added in order to create a more potent, free-base form of nicotine that's highly addictive. No other industry is allowed to add new ingredients to their products without first having them tested and approved by the FDA for safety.
That now changes forever. And so for the 3,000 to 4,000 children who begin every day, we're going to try and reduce those numbers as drastically as we can by affecting the marketing that the tobacco industry has used, specifically designed to go after children, by including candied flavored cigarettes and cartoon characters and figures on packaging.
Nobody likes someone who preys on children. No one. And for more than 4 or 5 decades, the tobacco companies have been preying on our children. They have literally been advertising and marketing their products so that kids will start smoking at an earlier and earlier age, knowing that if these kids get addicted at an early age, it's tough to quit, and they're likely to become lifelong customers of those tobacco companies. Well, there's a message in this bill for those tobacco companies that have been preying on our children. There's a new cop on the beat, and that cop on the beat is the FDA. That agency is going to be watching every move they make, the way they advertise, the way they market, what they put in their products, the warnings they put on their products, every step of the way.
No longer will big tobacco be allowed to gather more smokers by manipulating nicotine levels in cigarettes. No longer will tobacco lobbyists and industry scientists, sham scientists in these cases, be able to hide the real dangers of tobacco. No longer will we let our kids be recruited as the next generation of smokers.
This is a great victory for all Americans, and it's I think a wonderful way to begin the debate on health care reform, because this could be one of the most significant contributions to prevention of disease in the United States. There's approximately 8.6 million Americans who suffer from smoking-caused illnesses, and 400,000 Americans are said to have died each year from tobacco use. In fact, every family in this country can point to someone who's had their condition exacerbated or triggered a condition because of smoking.
So today we've taken the first great step, by the way, on the eve of the debate and markups of the health reform packages to do make a major effort in the area of prevention by eliminating or reducing one of the major causes of health and disease and illness and death in our nation.